Hello, my name is Jennifer Pekoski. I'm the Director of Nursing here at Hematology Oncology Associates, or HOA as we call ourselves. Thank you for choosing us as your medical provider. Throughout your journey with us, we encourage you to ask questions about your diagnosis, treatments, and medicines. This puts you in the center of your care and helps us continuously improve the quality, safety, and effectiveness of your treatments. You will be seen at either our Brittenfield office in East Syracuse, the Onondaga Hill office in Syracuse, or our Auburn office. The Brittenfield and Onondaga Hill offices are open from 7:30 a.m. to 4:30 p.m., and Auburn is open from 8 a.m. to 4:30 p.m. When you arrive, you'll be greeted by one of our associates who will sign you in to inform your medical team you've arrived. The associate also will ask to make a copy of your insurance card and driver's license. And if you didn't receive paperwork from us in advance of your appointment, that will be provided to you then. The paperwork asks for important demographic information and a detailed medical history our team needs to provide you with the highest quality of care. So, if you'll need to complete that in our office, please plan to arrive at least 30 minutes prior to your appointment time. Because hematology and oncology care visits are more complex than typical doctor visits, please allow for your first appointment to take from potentially 2 to 3 hours. This ensures time for additional testing that may be needed that day, rather than asking you to return another day. And, considering the length of time you will be away from home, please plan to bring enough necessary medical or nutritional supplies. When you're finished at the front desk, you can have a seat in our waiting area and take advantage of our complimentary tea and coffee bar until you are met by one of our intake specialists. We'd also like you to know that we have wheelchairs available for you to use at any time during your visit. So please, don't hesitate to ask. And while children under age 12 are welcome in our waiting area, for their safety, they are not allowed in our treatment areas. Your meeting with our intake specialist will be an official orientation to our practice. First, the specialist will verify all of your paperwork. She or he will take your picture to add to that record as an individual identifier, like your name and date of birth. This is one more way we ensure your safety as we proceed with your medical care. Once the paperwork is completed, the intake specialist will review some of the services available at HOA and give you an opportunity to ask questions. He or she will also give you the option to sign up for our convenient patient portal service for secure electronic communication. For the patient portal, you simply supply us with your email address, and then we send you instructions to go from there. Essentially, the patient portal gives you the opportunity to avoid playing phone tag for non-urgent questions. Communicating with us electronically, you can confidentially review your appointment times, look up lab results, request medication refills and appointments, all at your convenience. Patient portal messages and requests are reviewed during our normal office hours, Monday through Friday, and we normally respond to non-urgent inquiries within 1 to 3 business days. Everything you review with the intake specialist is outlined in this folder. Everything in here can also be found on our website, www.hoacny.com. The intake specialist then will accompany you to the appropriate area where you'll wait to be greeted by your clinical team. He or she will show you where the bathrooms and refreshments are. And once you're settled, The intake specialist delivers your information to the clinical assistant who will greet you next. The clinical assistant will take you to the treatment room and check your vital signs, including your weight and blood pressure. A registered nurse will review your medical history, family history, allergies and medications, and enter this information into your electronic medical record. At this first visit, you will be seen by your physician. Since our physicians and advanced practice staff work together as a team, future visits will alternate between them. Also, at future visits, your medication list is reviewed each and every time. It will be updated and revised as needed. We do ask that you bring your medication list and any changes to each appointment. On occasion, you may need to be seen by a provider who is not part of your team, but we try to keep your visits within your team. It's important to note that at HOA, we work as a team. We want our patients and their families to know and understand that your care is managed by that entire team. This includes your physician, advanced practitioner, registered nurse, clinical assistant, patient navigator, as well as a pharmacist and specialty technicians. We value your time and we do everything possible to remain on schedule, but sometimes unexpected delays can happen for a variety of reasons. We'll do our best to keep you informed of any significant delays, but at any time, if you feel you have concerns or questions about your appointment time, please feel free to speak with one of the representatives at the reception desk. During your visit, we also have safety checks to make sure we're delivering the highest quality of care to you. At HOA, it's our policy that staff verify your identity prior to giving you any type of treatment, test, or lab work. So expect to be asked for your name and birth date by every staff member during your visit, even though they may already know you. At the completion of your visit, you will meet your patient navigator who will help you with scheduling your future appointments and give you a printed schedule. We also have a financial counseling team at HOA available to help you with any questions you might have regarding your billing and insurance. Your patient navigator can set up an appointment for you to meet with them. At HOA, we are here to help you with any questions or concerns you might have. If you don't know where to turn, please ask one of our staff members and we'll help guide you in the right direction. Our most important message to you is that we, as a team, are here for you.